morning, everyone. I'm Stacey Berger. I'm the president and CEO of the Housing and Community Development Network of New Jersey. We're the statewide association of nonprofit community development organizations who've been working in New Jersey to make our homes and communities great places that everyone can afford to live and work. This is our second press conference with a number of partners to promote the funding of lead prevention in New Jersey. As many of you know, there's been a $10 million fund set aside since 2004 to fund the rehab and remediation of lead paint in homes in New Jersey. This is a major problem. A number of folks are going to speak about the problem, so I will not continue to talk about it, but I do want to let you know that we have with us behind these folks, we've got a big board up back here, and at the end we're going to ask the elected officials who are here today to commit to put that funding where it belongs in that $10 million lead hazard control fund to sign a show of their support. If they need to leave early, they can go ahead and sign and put that up, but we'll have plenty of time for people to do that if they would like. I want to first start with Lynn Weiss and DEBORAH Bradley from one of our board members and board organizations, Homefront, which is right here in Mercer County. They provide tremendous social services to homeless families and children in need, and I think that you'll hear best from them. So Lynn and DEBORAH.
Thank you. Thank you, everyone. Good afternoon. Like I said, I am Lynn, and our clients' children are breathing in these fumes and are affected every single day living in the area of Trenton. This is why we strive to please have something done. I had parents, Lauren and Richard, that were supposed to come with me this morning with their two sons, Noah and Richard Jr. And unfortunately, they had to take Noah back to Children's Hospital this morning, so they were unable to be here to speak to you this morning. But I would like to introduce Rashina and her son, Rasheen, and this is Rasheen and his grandmother, DEBORAH Bradley, who would like to say a few words, who live with, or one of Homefront's clients.
Hello, everybody. I have been in an apartment out in Trenton for 7 months, and my son was only like 6 or 7 months old, and we haven't been in an apartment that long. When he went to the doctor, he had seizures, everything. He never had problems in his life. And the apartment was let from the back to the top, to the floors, to every room in the apartment. I just want y'all to know that when y'all rent out these apartments, please make sure that y'all get a fully inspection, because the OC letter do not do nothing. And this is what my grandson growth, he have learning disability problems, he talk, he can't grow. You understand? And messing with his teeth, he have seizures, you know, he's not the same. So I just want everybody to know that when you rent these apartments, make sure that y'all have these apartments fully inspected, because the landlord really don't care about us. He just care about the money. He really don't care. Thank you.
Lynn mentioned another family. That's the one where they also, right? They also had a similar situation, and they're living in the Homefront Family Preservation Center because they can't return to their home because the home has lead in it and it can't be remediated. The Lead Hazard Control Fund will give low-income tenants and landlords the opportunity to fund those remediation programs. We know that that costs about $5,000 to remediate, between $5,000 and $10,000 once. Once we solve that problem, that home is lead-free forever. It will not come back. So putting this money into that fund is paying it forward for the next generation, like DEBORAH's grandson. Unfortunately, he is only one of about 3,500 kids that were found to have lead in New Jersey last year. This is a public health epidemic, and we need to make sure that those funds go where they belong. And we could not be more pleased to be here today with the leaders of the legislature and members as well to show their support for putting this money where it's intended.
I want to thank Stacey and all the advocates. This is an important day to be here to make this awareness, because we have funded it, but we need to make sure it gets into the budget. As Senate President said, from his daytime job as my daytime job as a code official, I know it firsthand about the codes and where we should be. And lead abatement is something that we should have been doing for many, many years. And to have this still into the 21st century, it is 2016, is unacceptable. As we hear all the problems throughout the nation, you hear about Flint and, water with the pipes. And coming from the trades, I can tell you that that is a whole nother issue that we're dealing with as we see levels high in Newark. But again, in these homes, it's unacceptable to these healthy children that actually can have a lot of lifelong effects by this exposure. And it only takes a remediation of it that it would take it away completely. This is something we have to fund. We have to put the resources there to be able to get it done. And I'm just happy to be here, to be able to be part of getting this across to everybody. And the administration has to do the right thing to make sure they sign the bill, and that we will make sure that it is in the budget and that it stays in the budget. Thank you.
So we asked the governor to put this in the budget. The network did, along with 108 other organizations. You're not going to have to listen to all 108 this morning, but I did want to acknowledge a few other folks who are here with us today. The New Jersey Association of County and City Health Officials are here, the Sierra Club of New Jersey, the NAACP, and Solutions to End Poverty Soon. And I know we have a few other folks in the room as well. I did want to offer the opportunity for some of our legislative champions who've been working on this bill to say a few words if they wanted.
Good afternoon. I am Grace Spencer, and I represent the 29th Legislative District, which is Newark and Belleville. So it's my town that has been affected by this new onslaught of the high levels of lead that is appearing in our water system. I'm the sponsor of a bill here in the Assembly that would appropriate $10 million to lead abatement. It's important that the governor gets the lead out, all right? Senator Turner said it's time to get the lead out of the homes. It's time for the governor to get the lead out of his system and get going by allocating this money back into the budget, because that's what's important. We're moving forward as a state, and in order to continue that momentum, it's important that our children have the best start possible. And the best start possible is with a healthy home. Healthy homes are key to the success of children as well as to adults as we move forward in this state. If we don't start with the children by getting the lead out, then what are we doing as a state, and what are we saying about the things that we are doing? Since 1978, lead has been illegal in paint. 1978, I was a toddler, and I was commenting with Speaker Prieto. I remember my mother saying, "That's not good for you," and I could hear my sister saying, "It's sweet, it tastes good, it's bright colors." All the key triggers that attract children to putting things in their mouth, sweet and attractive in color. This should not still be the problem today. Little Rasheen should not be eating the same things that my sister ate almost 40 years ago. That's not what it's about. It's time to get the lead out. Let's get moving. Thank you.
I'm Liz Moyo. I represent the 15th Legislative District here in the city of Trenton, and you're standing in one of the 11 towns across the state that have higher lead levels, poisoning levels than Flint, Michigan. And some of the earlier speakers have mentioned, and I want to drive this point home, that the #1 cause of lead poisoning is not water, but it's the paint in the homes. And somebody said to me today, we mandate that someone bring a baby home from a hospital in a approved car seat, and yet we send them home to a house that could be poisoning them as soon as they start crawling on that rug or holding themselves up on that wall. So we need to deal with this in a comprehensive way. It's got to be water inspections, paint inspections. We have a bunch of great legislation that's been introduced over the past few months and in previous years that has been vetoed. We are really going to be aggressively pushing these bills, and I would hope the governor finally listens and starts approving them. So thank you.
I'm very happy to be here to speak out on behalf of Parkside Business and Community in Partnership. We are a neighborhood-based, membership-based organization that's been working very diligently to restore and to bring life to the community there in the city of Camden. Parkside members, I'm here to speak on their behalf, as well as Camden residents across the city. We're concerned that there are 11 cities in New Jersey that have tested a higher percentage of children with elevated levels of lead in their blood than what was identified in Flint, Michigan. And while Flint certainly has garnered much deserved attention, we believe that New Jersey's children need help too. This is a statewide health crisis that's gone on for too long, and we believe that it must stop now.
Good morning. I'm Ray OCASIO, and I'm the Executive Director of La Casa Don Pedro. This question of lead in our cities is not just limited to the city, it's throughout the entire state and throughout our country. Lead paint has been with us for too many years. There's, in the city of Newark, there's an ongoing program to deal with families that are confronting the lead issue, but it's a very limited program by providing medical attention and shelter. On a daily basis, La Casa does inspection of homes, and we run into, during our weatherization work, we often encounter lead. We also can treat lead, but it's very limited because it's part of the health and issue aspect of the program that does only a small portion. If we replace a window, a dozen windows, we're still leaving wood, paint on the woodwork and walls, so that there's an opportunity, I think, to fund this program, fund lead, to target that those funds so that when we enter a home that has infants or expected parents, that we could not only just do the limited version of lead remediation or abatement, but we could do an entire household. That would be an efficient way of using this money so that it's used and affects children who are coming of age and are most likely. This is a long-term proposition. It's a long-term proposition not only to deal with the paint, but also our infrastructure in terms of the pipes that enter our homes and our schools. So let's get started on this. As has been said, let's get the lead out. Let's get it out of our system. Thank you.
The city of Camden was recently reported to have lead in its school water as well, and those kids in those districts have been drinking bottled water for the last few years at the cost of like $75,000, $80,000 a year. So we know that schools have a problem, and we need to make sure they have the resources to deal with that. I wanted to just ask Elise Pivnik from Isles, who did the original research on the 11 cities and 2 counties that have higher elevated lead levels, to talk briefly.
I'm from Isles. We're a community development organization based in Trenton. We've been working on lead poisoning and its prevention for over 15 years. And the most important thing for the message I hope everybody takes away from that the beacon that should be guiding state policy is prevention. We should be looking for ways to test homes, test water, test our playgrounds, to find out if there's elevated lead levels there, dangerous lead levels, remove the lead, and let children go on with their lives. So we have been, it's important, one of the things that we're working on now is a lead safe certificate program so that no landlord should be able to rent a house to a family that spoke to us today with high levels of lead. And that even goes for Section 8 housing. In this, right now, throughout the nation, you can be a landlord that receives a Section 8 subsidy and never be asked to have your home assessed for lead hazards before you rent. We can do better than this.
Hi, my name's Ann Vardeman. I'm the program director at New Jersey Citizen Action. This is my daughter, Miriam. And we joined with the Housing Network to start the Lead Kids Free NJ campaign. We've collected hundreds and hundreds of children's handprints, asking that lead funding for the Lead Hazard Control Assistance Fund be included in the budget. We've collected thousands of petition signatures. We sent a letter to the governor signed by 109 organizations, and sorry?
The copy
That's right there. Asking that this money be included in the budget. Last month, what Governor Christie said was that if this was important to the people of New Jersey, that he would include funding in the budget. He didn't. And then what he said this month was that this has been over-dramatized. I don't think you can over-dramatize over 3,000 children being poisoned last year in their homes and in their schools. And so I'm incredibly grateful to legislative leadership and all of the partners here and the elected officials who are taking this seriously, that this is a crisis, that we are going to fix the problem. And the governor, I sincerely hope he's listening to us.
We cannot reiterate enough that children should not be lead detectors. We need a preventative policy and preventative programs and the funding that our families need and deserve and our communities deserve to make sure that we finally do, as Senator Turner said, get the lead out. We know we can do this. New Jersey is better than allowing 3,500 kids to be poisoned last year or any time in the future.